And so
Yeah.
this whole I am I, the
Mm-hmm.
power of positivity, well-being for men and women, it's truly dear to my heart, because I didn't even know that this is what the topic was going to be. I
Mm-hmm.
thought that I was going to repeat small business, entrepreneurship, that kind of thing. But then God had me start my own well-being journey last year,
Yep.
2024. And then it dawned on me when I sat with you, like, this
Mm-hmm.
is it. This is what we need to talk about. Like,
Right.
people experiencing transitions in life, shifts in
Yep.
life, and needing that guidance, needing
Yep.
somebody to just ask those questions, to allow us to begin to answer ourselves.
Mm-hmm.
I was sharing, I think, the misconception of therapy,
Mm-hmm.
that people think you're supposed to go to therapy and the therapist give you all the answers.
Right.
And I have shared, no, it's the opposite. I
Right.
feel like you all ask the questions to be able to get us to think and to uncover what we need to talk about. I want to start by saying thank you so much for taking the time out to sit down with Queen Sheba. We are having our I Am I well-being sit down, and our topic is mental health. Yes, I'm
Yes,
just
ma'am.
super excited. I'm super excited because um, you became a very, very important piece in my life.
Mm-hmm.
And I just talked about this yesterday, how
I was on a quest to get
Mhm.
help as a single mother, dealing with all these new emotions. I just needed some help. I'm like, somebody guide me. But I was always referred to a psychiatrist who
Mhm.
only listened just enough to gather information to diagnose me with something and to
Right.
medicate me.
Mhm.
And even back then, I was open. I'm like, okay, you say I got depression, let me take the medicine. And so just being open to
Mhm.
say, okay, this is what the professional says I need, I
Mhm.
took it, but I wasn't functioning at my best ability.
Right.
I felt like it was slowing me down,
Mhm.
having me kind of like on autopilot in a sense. And
Mhm.
it didn't feel well. It didn't
Right.
feel well. So after 20 years,
Mhm.
I was referred to you.
Mhm.
And I was so grateful because I had never heard the words, okay, if you don't want medicine, I got somebody who is an advocate, who's going to speak up on your behalf. And I mean,
Right.
I'm crying tears of like all kinds of different emotions because I'm like, this
Right.
can't be true. And I probably, like, if I'm being
Mhm.
honest, I probably didn't even believe it
Right.
till I sat down
Right.
with you.
Right.
So before I
Mhm.
keep going on, I would love for you to introduce yourself and let us know who you are, um, so that people will understand. Like, all you got to do is sit with somebody like Miss Cassandra Gilliam to help get you
Well,
together.
well, of course, I am Cassandra. I have a wealth of mental health experience. I've been a mental health nurse for 20 years, and have been a nurse practitioner for the last two. But mental health has always been where I've been. It kind of came to me at a very young age. I deal with mental health in my family. I have a brother who's bipolar, and he was the first, you know, thing that I've seen, the first person to ever have that mental health issue. But I had a lot of substance abuse in my family. So I've always been around mental health, and it's just
Right.
always something that I love. And I'm a talker. So when I started doing what I do, I felt like because I talk loud, somebody's eventually going to listen. And the more
Yeah.
people that began to listen to me, the more I love to talk.
Yeah.
I see mental health a little differently than anybody else because the people who do mental health, you either love it or hate it. There's no in between with it.
Okay.
And I
Okay.
have so much love for people who I call my forgotten people because a lot of people they look over it. They don't try to help or they don't feel like they can help. And my thing is, even as a provider, medication is what I do, but it's not all I do. It's not all I do. It ain't the first go to. It ain't the first thing I'm gonna tell you, because I know other things work, and that's kind of how and who I am and how I became who I am. And I just continue to promote that with everybody who either sits in front of me, who reaches out to me, or anybody who can, under the sound of my voice, understand that as a provider, medication is what I do, but it's not all I do. It's not all I do. It ain't the first go to. It ain't the first thing I'm gonna tell you, because I know other things work. And that's kind of how and who I am and how I became who I am. And, I just continue to promote that with everybody who either sits in front of me, who reaches out to me, or anybody who can, under the sound of my voice, understand that, there are ways to get mentally healthy. And it's not always with taking a pill.
Yes. And I definitely don't want to overlook the importance of medicine,
Mhm.
because I know that some people truly need it and some people
Correct.
truly, they have an increase in function. And
Right.
so I just didn't know that there was
Mhm.
this thing that you explained to me, CBT.
Correct.
And so,
Correct.
could you explain a little bit more about what that is and how that is an alternative to medicine or something that can be added to medicine routines?
Got it. So again, I'm medication management focused in the beginning because I'm a provider. But even as I say that, and then yeah, it is people who need medication, but medication cannot stand alone. That's where therapy comes in. That's where cognitive behavioral therapy comes in. It is a targeted, it is a focused therapy. And what it does is it helps you to change the negative connotations, the negative thought processes into something positive. Because what keeps us down is that negative self talk.
Yeah.
So with cognitive behavioral therapy, it helps you to focus on that. It points out those triggers, those things that keep us to where we're feeling negative, and it helps us to fix it. So I would never recommend medicine without therapy because you need that. How you
Yeah.
think things, the things you think feed into how you feel, which feeds into your mental health. So if you change your mode of thinking, you can change the way you feel, and you really don't, sometimes you don't need that medication, but you need that specific therapy. Now there's different types. There's talk therapy, which is a lot of what me as a nurse practitioner does because I don't have that necessary therapy background. I do talk therapy. Mine is different, but I
Mhm.
do know the mechanisms of cognitive behavior therapy, and that's what it does. It does help to change that
Yeah.
negative thought process.
Yes. And Miss Cassandra, I truly feel like a lot of people are experiencing those negative thoughts,
Yeah.
and I'll take myself for an example. I choose positivity because
Mm-hmm.
I've seen a lot of negativity in my
Mm-hmm.
upbringing.
Mm-hmm.
And I saw how not being medicated can definitely be an issue. I saw in my family how addiction is real and how it can alter the way that you think, the way that you react. Overall, it's pretty much us choosing to
Yeah.
be our best self.
Yeah.
And a lot of times I think people, well, I'm gonna speak for myself. I know that sometimes I would be afraid, like, to share,
Mm-hmm.
maybe some of those
Mm-hmm.
thoughts.
Mm-hmm.
I myself personally have never been suicidal, but
Mm-hmm.
some of those thoughts, they was pretty mean. You know what I'm saying? Like, if I
Mm-hmm.
acted on them,
Right.
it could be
Right.
just as detrimental.
Right.
So having someone to definitely talk to and
Mm-hmm.
to let you know that it's okay, like, you're gonna have those thoughts, but there are
Exactly.
things that can be put in place in order to reroute that way of thinking and replace
That's
that way
right.
of thinking
Mm-hmm.
with positivity.
Yep.
Yes. So that's
That
the
is correct.
on. And
Mm-hmm.
and I want to continue to encourage people.
Right.
And so I do. I appreciate meeting you because
Mm-hmm.
again, I didn't even know that you existed. Okay, and so I know
Right.
it's a lot of people that may not know that people
Mm-hmm.
like you who definitely have this extensive background in working with
Right.
people and studying the way that we are and the way that we act.
Mm-hmm.
Um, I would say, can you help me define, like, so that people can understand a bit more?
Mm-hmm.
When you hear well-being, mental well-being, how do you
Mm-hmm.
define that so someone can recognize if they are tapping into the well-being of their mental health and not ignoring things that they can work on?
Okay. So I actually had to, I look at well-being on a continuum because I look at a lot of things on a continuum, on a spectrum. But what I will say is your well-being focuses on your emotional, your psychological, and your social well-being. And what that means is it impacts how we think, how we act, and how we influence like others around us and how we handle stress, which is the biggest part. It really impacts a lot of that and how we relate to others and even
Yes,
how we make
ma'am.
choices. So it is a continuum, it's a spectrum. Everybody's well-being can be measured differently, but it's still how you emotionally, how you physically, how you psychologically either relate to things and how you internalize and then actually, respond to different things. So everybody's different, but everybody learns and grows differently. But it's a continuum. It's a spectrum.
Very. So you pretty much told me why you love what you do, in a sense, because of your
Mm-hmm.
family and the
Yeah.
need that you saw there. So tell me about when you decided, hey, I want to go to school for this. I want to, be a better me for everybody else too.
Right. So when I started nursing school, and I told you I've been a mental health nurse for 20 years. When I started nursing school, you got to find, they say, your niche in nursing. Everybody find what you love, find what you love. So as I was in my first mental health rotation, my first mental health patient I took care of, this man fascinated me. And I sat with this man as he was talking. Now he was an active psychosis. Now anybody else would have been afraid of this man. I was fascinated by him. I wanted to understand why he was thinking the way he was thinking and why he was saying those things. And the teacher came to me. She said, I need you to move away because this gentleman is an active psychosis. I said, I don't want to. I want to understand it. I want to see why he's doing these things. And it was that day I realized this is where I need to be. These people
Wow.
don't scare me. They
Mm-hmm.
intrigue me. I want to know
Mm-hmm.
why they think the way they do. And then I want to help him. I want to get him to think better, to be
Yes.
better. So I knew then that I was going to be a mental health nurse and I wasn't going to be anything but that. And once I started becoming, but once I became a mental health nurse, I'm like, you know what? I'm helping them, but I can help more. Because as a
Mm.
nurse, I was helping on a smaller scale. Somebody else was telling me what to do.
Uh-huh.
Okay, give this patient this medicine, and that's what I was doing. But I said, you know what?
Mhm.
As a nurse practitioner, I could become a bigger help. I could be that advocate, that change agent that these
Mhm.
people need. So I
Yes.
needed to go back, and I put it off for a long time. I did. I helped everybody else I know go back to school, and
Mm-hmm.
my brother and this one nurse I had, she said, "You helping us? Why don't you go?" I said, "Because I'm too old
Yes.
now. You know, I've been in this so long that I can't see myself doing anything different." She said, "No, ma'am, you've helped all of us. You have so much knowledge that you can use. Go back."
Yes.
And when I
Yes.
went back to become a nurse practitioner, it was the best thing I could have done because now I can be a bigger help to the population that I
Yes.
love. And this population that a lot of people don't want to deal with. But this is all I want to do.
Yeah, share. I know that you shared about this one patient. Can you share another everyday situation that people are dealing with that you help them address and begin to work to overcome?
The main things that I see, depression, anxiety, those are kind of the reign supreme. But what I'm seeing a lot of now is trauma. A lot of people are starting to really confront and identify that yes, my upbringing was traumatic. Yes, I went through so many things and I didn't even think that it was
Mm,
trauma until
mm,
I sit in here and I talk to you. And now I realize, yes. So I see a lot of trauma. And
mm,
the reason these people can relate to me is because I have my own trauma history. I have my own trauma background. And I can look at somebody and say, you've been hurt. Tell me
mm,
what happened. Because I can see it. You
mm.
go through your anxiety and your depression, but it's something else underlying. I need to get to that. What is that? What happened to you? Who
Yeah,
hurt you? And once they start talking to me, I give them a part of me and say, you know what? I get it. I have my
yes.
own trauma history, but I can tell you that it gets better. I'm living proof of that.
Mm,
I can tell you that healing does happen because I am living proof of that. I am every day becoming a better version of the person that I was yesterday because
yeah.
I learn and I grow. So I see a lot of depression. I see a lot of anxiety, but I see a lot of trauma. And as I
Mm,
see those things, it makes me want to help even more because I know trauma is where everything lives.
yes.
Trauma is where everything stems from. If you can
Yes.
get to the root of that trauma and fix it, it fixes so many other things. And
Yes,
I tell people
ma'am.
that every day, just about.
Mm. And that's so important, just like you say, just a simple question of asking you what happened.
Yep.
Because so many people, even positive minded people, they put
Mm-hmm.
themselves in busy positions, they wear
Right.
many hats, they mean
Right.
well, but like you say, that trauma on the inside can start showing up in the
Yep.
choices. And then they're
Yep.
wondering, well, what happened? And so it
Mm-hmm.
is important to reflect on our childhood. And that is a topic of conversation that I've had this week.
Mm-hmm.
Childhood does impact our adulthood, and how it is important for us to start these conversations with our youth to pre-adults, because then maybe we can curve some of the experiences that they would, have in life. Maybe listening to others who have been through, they'll say, you know what, I don't think I even want to try this. And that's what we need: more conversation and more
Yep.
asking questions, just simple.
Yep. Yep.
And then when you are the kind of people that we are always giving,
Yep.
a lot of times people don't ask us what's wrong. And
Exactly.
so, as far as those who may be skeptical about therapy,
Mm-hmm. Mm-hmm.
maybe they're not ready. Maybe they're not
Right.
ready to actually come and sit with somebody. But what are some things that you would suggest that someone can start doing at home to shift that mindset, and to build that courage that
Mm-hmm.
it's okay. It's okay to talk
Right.
to somebody.
The first thing that I think helps is understanding that it's okay to not be okay. That's the first thing. You got to understand that sometimes we get into that moment of not okay, but we can't sit in it. You can't sit in it. A lot of people have that misconception with therapy because they don't want to tell their life story to somebody. They don't want people to judge them. Understand that therapy is not judgmental. That's one. You got to
Yes.
understand that's not what we do it for. But if you're kind of on the fence about therapy, things that I started doing before I even went to therapy, and my brother is a therapist. Journaling is a big thing. A big thing. I write. I write my
Yes.
thoughts out. When I didn't do anything else, my brother would tell me every night, "Did you journal? Did you journal?" Journaling is cathartic. It really helps you to put an end or put a pen into, okay, this was my day. This is what I thought. This is how I felt. The way I would journal as if I am speaking to somebody. If I had a rough
Mm,
day, I would journal to that. If I had, a hard day with a patient, I would journal to that. So journaling is a big thing. If you don't do therapy initially, start journaling. Start
I love
getting those thoughts out. Okay. The next
Yes,
thing
ma'am.
is start identifying your triggers. What triggers are
Mm.
the things that happens that precedes the increase in any anxiety or depression or whatever the case may be. Those are the triggers. Start identifying them. Start being more cognizant of what's happening prior to, so you can start working on
Yes.
those things. So you got to identify what's causing it. People, when I talk to patients, they get so tired of me saying, "Well, what's your trigger? What triggers it? I don't understand what you're asking me." Something precedes it. What is
Yes.
that? You got to
Mm-hmm.
start identifying that, because when you're in therapy, that's what the therapist needs. You got to take that to them. So, like
Yeah.
at 12 o'clock, my anxiety gets high all the time. And usually it's high because I have this going on prior to. I said, that is your trigger. That's
Mm-hmm.
what you need to take to therapy. So even before you get
Good.
in front of a therapist, start identifying those triggers, identifying those stressors, and start journaling, start writing things down, start being more observant of you,
Mm.
your life, what's going on in it. And that's just a
Yes.
start as to how you can kind of break into the therapy realm.
Yes. Yes, Miss Cassandra. I love it. I love it. So I don't know if you have any numbers to share, but what is the success rate of your clients who use CBT compared to those who may not use anything or medicine alone?
So I will say I was looking up some statistics, and I don't really have them off the top of my head, not all of them, but I do have a few, and I'm going to read them from one study. And this study focused on just people with depression, but they said that people with depression who kind of use CBT in the long term of that study, about 50% of those people had a reduction or a improvement in their symptoms, even without medication. That was just CBT by itself.
Okay.
And then in one other study, it said it went as far as, depending on how big the study was, 72% of people showed improvement with just CBT alone. That's not even with medication. Now, with medication, that goes up to 80 or 90%. But with just CBT alone, 72%
Wow.
of people said that helped them. They were
Yeah,
able to learn coping strategies and mechanisms that helped them to get through
that
their
part.
days.
Yes,
So
coping.
it
Yes.
varies with the patient, it varies with the studies, but anywhere from 40% to about 80% is the range I'm gonna give that shows that CBT is very, very successful, very, very important. And I recommend therapy to anybody. Anybody.
Yes. Yes. Those are some really good numbers. That's some really
Yeah.
good numbers because that's even showing how many people are open to even
Yep.
try it.
Yep.
So anybody who listens to the sound of our voice, this recording, any pieces of this recording, I truly hope that that's what they pull from this, to be open,
Yep.
to be your best, how you say it, the best version of yourself.
The best version of yourself. You got to be the best version of you. And that being open is very important, because a lot of people feel like if I ask for help, I'm weak. It takes a strong person to tell somebody I'm not okay, help me. I
Yeah.
think the strongest people are the people I encounter in my mental health realm. Y'all are strong people to me, because you can go along and just get along in life and pretend like you're okay. Anybody can do that. I know I did it for years.
Got
Anybody
you.
can do that. But it takes a strong person to sit down and say, you know what? I need help. I
Yes.
need help. Please help
Strong.
me. Mm-hmm.
Yes. I love that. So, Ms. Cassandra, so I know that you have been in the field over 20 something years. Um, can you give us like a timeline of like different places that you have worked, and where you are today? Here you have a private practice.
I do have a private practice. So let me take you back so I can bring you forward. So
Okay.
I've been in mental health for a long time. I have been a mental health nurse. I've been a nurse educator. I taught college. I started programs. I have trained nurses. I
Yeah.
have taught nurses how to be mental health nurses. So I've been in this game a long time.
Love.
And that was my start. And as I was transitioning from my last position, which I opened programs from Georgia to Florida, training
Mm.
mental health nurses to go do home health mental health care with these
Oh,
patients.
that's awesome.
That was my initial transition, and then I became a nurse practitioner. So I have
Yeah.
been working for somebody outpatient in a facility for the last 2 years, and decided, you know what, I can do this myself.
Yes.
So I sat down one night and talked to my brother, who is always my voice of reason and my
Yeah.
biggest supporter, and said, you
Yeah.
know what, I want to start my own business. He said, what are you thinking? Let's talk it through.
Mm-hmm.
And so I
Mm-hmm.
did. I said, you know what? I'm going to LLC myself. He said, what are you thinking? What would you call it? I said, you know what, Quincy? That's my brother. I said,
Mm-hmm.
I want a name that lets people know, hey, this job, this entity is going to help you be a better version of the person you are. My brother said to me, a new you. I
Mm.
said, that's it. A new you,
Ooh, you gave me
psychiatric care. And
chills.
that is what I became. And I
Yes.
went and I took it and I ran with it. And I LLC'd myself. And I said, you know what? I'm going to help people become better versions of themselves. So right now, that's where I sit. And I have been working for somebody for so long. And I'm transitioning from working from somebody, and I'm going to stand on my own and work for me. So a
Yes.
new you is about to be revitalized. I'm
Mm.
gonna put my whole self
Oh,
into
wow.
it. And I'm gonna see patients on my terms. And I'm gonna help people the way I know that I can. So
Yeah.
that's where I'm transitioning to. My office is, I have an office in Macon, but I'm also virtual. You can catch me in the virtual realm as well. So I'm
Yes.
giving so many different options for people who can see me, because a lot of
Yes.
people can't get to me in person, but that's okay. You can still reach me. You can
That's
still reach me.
right. Yes.
So I am expanding. I'm also expanding. I have licenses in Georgia, Florida, Utah, Washington,
Okay.
Kansas, and
Okay.
Oregon. I am trying to reach as many people as I can reach. And that's just the start. I'm just starting
Yes.
out.
I'm so
I am just
excited.
I am
Wow.
just starting, because I would tell my daughter all the time, I say, your mom, her name is going to be known for something great. I
Yes.
said, and when people speak my name, they're going to say, you know what? Cassandra did the best job for so
Mm.
many people. She did the best she knew how to do to help people. I said, my name is only going to be spoken in a realm of she did her best. She really
Yes.
wanted to help people. And
Yes.
that's what I'm doing. So right now, to reach me, I have, my business number, and I can leave that. My business number, if you want to reach out to me, this is the best way to get me. My
Yes.
number is 478-796-4896. That's the best way to get me. You can Google me. Google Cassandra Gilliam. I will pop up on Psychology Today.
Yes.
You'll see my profile. You Google my name, you'll see Growth Therapy. That is my billing company. That's where I started. So if you Google Cassandra Gilliam, I will
Yes.
pop up. And
Yes,
you will be able
ma'am.
to follow me. You will be able to find me. And if you feel like you need help and you feel like, hey, well, I fit the criteria of somebody who can help you, come find me. I'm here
Yes.
for you.
Yes, ma'am. And I definitely have shared your information. And I shared it. I know I shared it with a couple of people, and I know that they weren't ready.
Right.
But I said, hey, go and check her out.
Mm-hmm.
And I love your website. It's very informative. And that is where I learned even more about CBT,
Mm-hmm.
cognitive behavioral
Your
therapy.
therapy, that's right.
Yeah, I thought that was just amazing. And a
Mm-hmm.
lot of times when we don't know, we just don't
Mm-hmm.
know. And I just feel like it's my mission to keep these
Mm-hmm.
conversations like this going, keep
Exactly.
connecting with amazing people just like you who are out here in the communities eager and
Right.
ready
Right.
to be an aid in this thing called life.
Mm-hmm.
I tell you, because
It
it's a
is.
challenge,
It is. It
but it
is.
can be so beautiful when you
Mm-hmm.
put in the work. You got to put in the
Yeah.
work.
You got to put in
So,
the work. Mm-hmm.
yes. So, I want to just thank you for doing your time, your due diligence, and going to
Mm-hmm.
school and learning and getting out in the world and really experiencing people in person. So that now, today, yes, you can offer your services in
Yep.
multiple ways. So,
Exactly. Yep.
yes,
It works. So
yes,
you can't say you cannot access mental health care, because we are here. We are in
yes,
so many avenues. If you need us, reach out
yes,
to us. We are here to help.
yes, yes, ma'am. Well, I believe that you have covered us really well on how that we
Mm-hmm.
can keep a check on our well-being. And I truly appreciate that reminder of journaling. And I know that people are doing that more and more
Mm-hmm.
today. But to give the purpose behind it,
Yeah.
not to just, I mean, of course, you can just write about your day, but I love
Mm-hmm.
how you said speak to the issue. Write as if
Yep.
you're speaking to the issue
That's right.
and you can work it out. And
Mm-hmm.
if you need some assistance, we can reach out. We can reach
That's
out
right.
to
That's
you.
right.
Um, and then for those who may say, hey, I don't know how to identify my triggers, I love how you ask them what came before
Mm-hmm.
you started
Yep.
feeling this way.
Exactly. Yeah.
And it is about slowing down and just being
Mm-hmm.
intentional about what we're doing.
Right.
And I just pray that, yeah, more people become more open.
Mm-hmm.
I know when I came to you, I was like, I'm in this transition in life and I don't
Right.
know what my purpose.
Right.
I know that I love people. I know I want to spread
Right.
positivity. And so even just sitting with you, you helped me begin to calm down,
Yep.
make a list of things,
Yep.
and start checking them off.
Yep.
So I just greatly appreciate you. I tell you,
No problem.
you're awesome. You're awesome.
I
Um,
try. I
yes,
try.
ma'am. And yes, at that time, my insurance, you didn't take my particular insurance. But that's okay. You connected me with someone amazing who
Yep.
takes my insurance.
Yep.
So I just thank you for, not gatekeeping, not trying to be
Right.
selfish, not
Right.
trying to force me to self-pay.
Mm-hmm.
Um, but I looked at your prices, they're really reasonable, even for
Yep.
those who may not have insurance that you're covering right
Yep.
now, but you have a lot of them. I need people to
Yep.
understand Miss Cassandra is
Yep.
out here growing,
I
adding
am.
things to
I
her
am.
business. I'm
I
just
am.
so proud. I'm so proud of you.
So what I would say this is, I want to help people. So I'm not one that is, I mean, yes, I have to get paid for what I do, but I'm gonna work with anybody who wants the help. So even with my numbers, I flex as I need to. I tell people, hey, I may not take your insurance, but let's see if we can work this out. Let's see if I can find a way to see you, even if you can only give me X, Y, and Z. And I know that because I want to help you. So my goal is to help people. So don't let the fact that you don't have insurance, don't let that deter you. I know that some of these cash rates I hear are ridiculous. And I look at them and I'm like, you know what? I'm not trying to break you. I want to build you. So in order to do that, we got to start somewhere. So I'm going to help you build regardless. Just know that whatever you got, we'll work with it. I will work with you no matter what.
Mm. Now that love. I feel the love.
The one thing I do want to say is we are breaking stereotypes. We are breaking down barriers. I need people to understand that as a people, as a race, as anybody who needs mental health care, don't ever feel ashamed to say you need help. We're going to keep kicking and punching and breaking down these walls, that stigma that surrounds mental health. I am one that is going to keep fighting till people understand it is okay. And I'm going to say it until my face turns blue. It is okay to not be okay, but do not sit in that period of okay and do not reach out for help. That stigma may still be there. It's there for now, but more people like me, we're breaking that down piece by piece, brick by brick. We're tearing it down. So if you need the help, be open to the help. If you come to me, you are open, you are honest, and you are ready. I am willing to take this journey with you step by step. I will be there. And I promise you, at the end, you will come out a better version of the person you were. I can promise you that.
Yes, I know. Yes, honey. You keep changing lives. I mean, I'm so proud of you. I'm so proud of you.
Appreciate that.
Yes, ma'am. So I greatly appreciate you for being a part of the mission and purpose of getting the word out and letting more and more people know that, yes, services are affordable. And then there are tools and strategies that you can use at home to get you ready. Okay.
Yep. Yes, ma'am.
This has been something. I have. I'm out of cards. I'm out of
I am
cards
glad
because
that
you hit some points that I had written, but you wrapped it right on. Yeah.